Good afternoon, Mr. Herbert.
Good afternoon, Ms. Anya.
Okay, happy to see you today. And what do you do?
I've worked in Banso Baptist Hospital as a general laborer on contract for 1 year, 8 months, and on permanent work for 1 year.
Okay, since 2000
2015.
Okay, so I understand that you have been receiving treatment from the mental health department here in Banso. Can you tell me a little bit about that?
Okay, I actually received treatment here since 2000, February 2015, when actually I just came to know that actually the CBC or Banso Baptist Hospital is open to people who have mental problems. So actually,
what kind of mental problem were they treating?
okay, they were treating schizophrenia.
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 And you've had this problem for how long?
I've had a problem since 2010.
Since 2010. Have you ever been on medications before 2015?
Yes, I've been on medications. I went through traditional medications for around 5 months. The treatment there actually was not as perfect as I can say as that I'm taking here in Banso in BBH, and actually it was on and off. The treatment was sometimes I'm on, I'm better, and sometimes I go off again.
So there were periods of relapse.
Yes.
Okay. So when you came to Banso Baptist Hospital, you started receiving another kind of treatment.
Yes.
What kind of treatment are you on presently?
The drugs they are giving me, I have carbamazepine and risperidone that I'm taking now presently.
Okay. And how is the treatment going for you now?
The treatment is going on well. As I see, I'm very much improved compared to the other previous days, years, or months.
I understand that you are now working in the hospital where you're receiving treatment from. How did that happen?
Okay, it all started with the help of an assistance of the administration and the help of you present the department head, and actually with proposing me that to actually have something doing to occupy me, not to be moving again around about, and with that I will actually be very much improved in my medication and treatment. So actually it started with you, and actually you asked me to apply, so I applied, and I was granted the work to working here, and just general level as I started in the incinerator, BBH incinerator, where I was burning medical waste and other waste.
Okay. And you said you had been moving on the streets?
Yes.
And what about presently? Are you still moving on the streets?
Presently, if I'm still moving on the street, it's not as frequent or as often as I was doing that. And if compared to those later days that I was actually moving, sometimes I will speak, and people will see some lack in me. I will not see it, people will see, but presently it is the treatment goes on very well, and even if I stand somewhere, I will know where to stand and what to do.
Do you have a place where you stay presently?
Yes, I have a place. I have a house where I'm renting.
You rent the house and pay for the rent by yourself?
Yes, I pay through the money, the salary, the wage that they give me at the end of the month.
Okay. So you're able to take care of yourself to a certain extent?
Yes.
With the salary that is being given to you from the hospital?
Yes.
Okay. Well, we are really encouraged, and moving on the streets, talking things that don't make sense and all of that, and presently you're no longer that way. How were people treating you when you were moving on the streets?
Okay, people were treating me, sometimes people would speak negative to me, sometimes some will speak positive. Those that speak negative would call me in the dialect Ngaba, a mad person, and those that are positive will be saying that no, it does. Even if he's a mad person, he has something to do, that's a role to play in the society. And so it is the example from the positive people that I was always copying, because actually it's true that actually even if you are suffering from a mental problem, you also have a role to play in society.
Were you able to understand that these people were insulting you at that time?
Yes, I was able to understand. The voices were clear, they were speaking clearly, loudly to the hearing of everybody.
Okay, so even with schizophrenia, you understood negative comments differently from positive comments. You knew the difference.
Yes.
And you appreciated them differently.
Yes.
Okay. And how do you feel now? Now that you are stable, you live in that same community where you had a mental problem. Are there times where you feel ashamed to move? Are there times when you feel bad about yourself because you have had a mental problem before?
Before it was that, I was always afraid, I was ashamed to move sometimes like that. But presently, since I'm now, let's say I can say responsible in a way, because actually now I can take care of myself, can take a bath, can wear clean dresses, can take care of myself.
What can you really say? Just one question. What can you say about schizophrenia?
Okay, I can just say schizophrenia is just like a disease that attacks someone from the brain, and actually the person has some depression, the person has some forgetfulness and many other things. And actually the schizophrenia actually is manifested in many people, and actually I remember once you had said when we were presenting in chapel in the presentation that there is no health to mental health, that no health without mental health. But schizophrenia is different from that other one, because actually your own is persistent, and actually, but it can be treated as, and that is a good thing in it. It can be treated.
Okay, so it is a problem in the brain which can be treated, and they can receive treatments like every other
sickness. Yes.
So, what can you really say to people who may be listening to you, or other people who have patients with schizophrenia? Any word for them?
Okay, the word I can just tell them is that actually those that are suffering from the schizophrenia, that they should not be, let's say, they should not just say that all is ended for them. They still have a chance in coming to any health facility, and it's just like that they should identify the particular problem that they have, and actually everything will be okay, just like any other sickness that can be diagnosed and treated. So I can just tell them that they have chances, many chances for them to be treated like just like myself.
Okay. And what about the people who have been stigmatizing you, saying negative things about you? Any word of advice for them?
Okay, I can just advise them that actually they should not be negative to many people, and because actually if they are negative to people like that, the people may shy away from actually moving like normal people, because actually not everybody, if they are speaking negative, not everybody has the same character, because other patients like that, you may speak negative like that and the patient just be violent on you, and you may, some people have lost their lives like that because they were negative on some patients like that. But actually they should speak positive and think positive.
So all these people with schizophrenia are equally human beings,
Yes.
And they should be treated like human beings.
Yes. Yeah, I have a bracelet, and it reads education, recovery, and hope, and cures.
Thank you very much, Mr. Herbert.
Thank you very much, Ms. Anya.